Joining me is our State Health Officer, Dr. Mary Currier. Thanks so much for joining us, Dr. Currier.
Absolutely.
What does a State Health Officer do?
Well, I run an agency that has clinics in every county except Issaquah County, and also liaise with the legislature and work for a board. So it's like running a giant business that's related to prevention and health.
So your primary role is preventive medicine, and you do a little health care with that. Is that right?
That's right. We work very hard to promote prevention in communities, but we also have clinics that provide safety net services.
Right. So we're talking about immunizations and trying to figure out who calls the shots on what. Who determines what immunizations people, not just children, in Mississippi should get, and when does that mandate kick in?
Mm-hmm. So there's a school immunization law. Every state has a school immunization law, and the health department decides what vaccines are required for school entry. In general, recommendations for people to be vaccinated, adults, children, infants, adolescents, come from CDC and from other places, but we follow and make the same recommendations as the Immunization Practice Advisory Committee out of CDC.
Okay, so the CDC is this federal government agency,
right?
Centers for Disease Control in Atlanta, and so you get some kind of information from them every year about what they recommend for immunizations, and the state gives you the authority through this law to implement what part of that you think is appropriate for Mississippi. Is that correct?
Correct. There's a subset of vaccines among the recommended vaccines that are actually required for school entry. That's right.
Okay, so when does that law and authority kick in? Does it kick in as infants, as preschoolers, or kindergarten? Where does it kick in?
As long as the child's had the appropriate vaccines by the time they reach kindergarten entry, they could get them all in the year prior to starting school. There's no law that says they have to be vaccinated as an infant. Now, the recommendations for the safety of the child to prevent disease are that they start in infancy.
So the responsibility for immunization of young children, infants, is with the parents and the primary care physician, who's usually a pediatrician or family medicine doctor, in that period up until, is it pre-K or K?
Kindergarten. It's for kindergarten entry. And, you know, we'll have to work that out as public pre-Ks come online, because there's some vaccines that are not recommended until you're a little bit older than pre-K, really. But yeah, absolutely. It's the parent's responsibility and the physician, the care provider's responsibility to make sure those kids are appropriately immunized and protected.
So many of our kids are in daycare now. Mm-hmm. How does the daycare piece fit in there?
We also have requirements for daycare center entry that are very much like the requirements for school entry, but they basically say a child must be appropriately vaccinated for their age while they're in a daycare center. And that's not just to protect the child, but to protect the other kids in the daycare center. You know, there are diseases that still occur that those children can pass along to other kids in the daycare center who might not be old enough to be vaccinated.
Right. So if parents have the discretion to immunize or not to immunize during the infancy period, why do they not have that same discretion during the school period?
The vaccines that we require largely are for things that you can catch in the school setting. So, for example, DTaP, which is diphtheria, tetanus, and pertussis, comes as a package deal, and it includes pertussis, which is one of the things that's still around that we still have in the state.
That's whooping cough, right?
It's whooping cough, yeah, sorry. Whooping cough is one of the things that's still around that can still kill children. We still see a little bit of it in the state. We had about 60 cases in 2013. So we want every child in the school protected. If we vaccinate all the kids who can be vaccinated, who don't have a medical reason for not being vaccinated, then we can protect the ones who can't be vaccinated or who didn't respond to the vaccine. Vaccines aren't perfect, so not everybody develops immunity when they're vaccinated. Most people do. But if you vaccinate as many people as possible in the school setting, then you'll prevent transmission within the school setting. And the same thing is true really if we vaccinate our kids, then we're protecting their grandparents, we're protecting the infants in homes who are too young to be vaccinated. We're preventing transmission by getting that child vaccinated. So it's not just about that child, it protects that child, but it's about the people around that child and protecting them as well.
So what are our compliance rates with the recommendations? Do you have a handle on that?
We actually do very well with infant and school-age vaccination. The CDC looks at how well kids are vaccinated by the age of 2 in the state. So this is not just for school entry. This is appropriately vaccinated by the age of 2. And we're usually within the top 5 or 6 in the country on a yearly basis for those vaccines.
Okay, so if parents choose or want not to immunize their child for whatever reason in the public school system, they have to request that they not be immunized. There's an approval system. What is the opt-out, the present opt-out option for parents?
The Mississippi law allows medical exemptions for vaccinations, and the way to get a medical exemption is to go to your private provider who can say, yes, you don't need to get this vaccine for whatever reason, and they send a letter or some sort of written transmission to the local health officer who can approve that. We don't have religious exemptions in this state. 48 states have religious exemptions, and we don't, because they were found unconstitutional by our state Supreme Court. We used to, long ago, have religious exemptions. We don't anymore because of the Supreme Court ruling. 18 states have philosophical exemptions, so if a parent says, I don't want my child vaccinated because I don't think vaccines are good, then they can go through some sort of process and get their child exempted just because they don't believe in vaccines. 18 states have that. We don't have that. We would really like to not have that. There are places in this country where it's easier to get an exemption than it is to get vaccinated. And in those places, we're seeing a resurgence of pertussis, whooping cough, and measles. You know, those things are not benign. We've really been victims of our own success. People have forgotten what those diseases do to you. Whooping cough can kill an infant, and it can leave them brain damaged. It's a really deadly disease in a small child, and those infants are too young to be vaccinated. So we need to vaccinate people around them to protect the infants.
Let's go back to that religious exemption that we don't have.
Right.
Is that at all threatened or involved in this Religious Freedom Act or that's being considered?
You know, we've not heard that. There are people in the state who would like to see philosophical exemptions, and that's really the thing we're hearing is the request for philosophical exemptions.
So why do people, as a public health official, you must hear these discussions or be involved in these discussions? What are the objections?
Well, twofold. One is that people believe that there are complications from vaccinations that are worse than the diseases. And you know, there was a lot of talk in the past about vaccines and autism, there is no link between vaccines and autism, and that's been shown time and time again. And so parents are concerned about the process of a child being vaccinated and the possibility of complications, and it worries them. And I understand that, being a parent myself, it's a scary thing. But in truth, the vaccines are very benign, cause rare complications, and most of those are mild. The other issue is, it's my child, I should be able to decide if they're vaccinated, which I understand that as well. My child, I want to decide everything about that child. However, it's not just that child who's affected by whether or not they're vaccinated. It affects the people around them as well. And if that particular child's not vaccinated, then they're a risk to the people around them who either can't be vaccinated or didn't respond to the vaccine. Can't be vaccinated because they're too young or they have a medical contraindication. My mom, for example, has rheumatoid arthritis and takes medications that make her immunosuppressed. I don't want people around my mom who haven't gotten the flu shot in the winter. And so she's very careful about where she goes because she knows that not everybody gets a flu shot in the winter. She gets a flu shot, but she may not respond well to it because she is immunosuppressed. So that kind of thing.
So we're still having outbreaks of these communicable diseases in our state, and there are reports of larger outbreaks in a number of areas of the country. How does that sort of fit into the debate going on here in Mississippi?
So we still have pertussis in the state. Like I said, about 60 cases last year, but we haven't had measles, and I say that what contributes to that is that we have a very good vaccination rate. The places that are having measles have pockets of folks who are unvaccinated. It gets imported from some other country that has a lot of measles, and then it gets spread among groups that are either, among folks who are either unvaccinated or didn't respond to the vaccine. So that's what happens. Most of the measles in the country is related to someone coming back from another place and then spreading it locally.
And I presume that a reasonable number of immigrants in the country that come here illegally are not immunized as well, so we would have continual traffic coming in?
You know, that's true, but we've not had an issue in this state having, for example, measles, and we'll vaccinate anybody who walks into our clinic because it's a public health issue and it protects everyone.
So we have this group of people who are very, very passionate about the issue of control of the destiny of their own families. And you mentioned the data. There's scientific data that, for instance, the autism thing
Right.
Is not related to vaccines, and that the risks are very low for these immunizations. And we've heard from people who say that they don't trust the government and they don't trust the physicians. And that's their problem. It's a matter of trust. Where do you think that's coming from, and how are you addressing it?
You know, that's a really difficult issue because there is a lot of mistrust and distrust. And I think some of that is founded in the history of things occurring that people find out about later and didn't know were done. So all I feel like we can do is be the most open and the most transparent about everything that we do that we can be. So as the health department, one of my goals is to make sure that everything we know the public knows. So if there's an outbreak of anything, if there's a case of anything that puts people in danger, we get that out to the public as soon as possible. And to know that our goal is the health and safety of the people of the state. There is no other goal. I don't take money from vaccine manufacturers or anybody like that. But all we can do is continue to say what the evidence shows and what our goals are. I don't know how else to combat that.
Do you report the adverse effects from vaccines?
They go to a national repository of such things, the Vaccine Adverse Events Registry. And yes, we do, and so does every other pediatrician or person who gives vaccines.
So you can actually determine that online by looking up Mississippi?
You know, I haven't looked at that in a long time, so I don't actually remember that. I know what I hear from our own clinics and what I hear from other folks about adverse events. For example, if you look at the list of adverse events, one of the things that's listed on there is anaphylaxis, which is a giant allergic reaction. And that would scare me. And we've not, that I can recall, and I think I would remember it, had one since I came to the health department in 1988. That's at the central office. I actually came to the health department a little bit before that in clinics, but since 1988, I can't recall one of those. So they're very rare, those bad
Are
issues.
physicians required to report those adverse effects?
Yes.
Okay, so we should be getting that information
Yes.
if it was occurring.
And it's all looked at by the CDC in taking into account their recommendations for vaccinations. And they really do look at it. For example, rotavirus vaccine, which is a vaccine against a virus that causes bad diarrhea in infants. it appeared that there were a few cases of severe reaction to that intussusception, which means that the gut folds in on itself. And so they withdrew their recommendation and started over again on the vaccine and looked at it again and changed the vaccine and made them go through looking at how the vaccine works all over again before they would let it back on the market and before they would make it a recommendation again.
How does the CDC decide which vaccines are given when? And what is the influence of the drug industry on that decision-making process? I think a lot of people think that there may be some kickbacks or money issues going into doctors giving these immunizations in the first place, that there may be some benefits to them to give truckloads of vaccines. So how do they come up with the list, and why do you get so many of them?
You know, for a long time it was difficult to get drug manufacturers to even make vaccines because there was such a risk of being sued, because people said whatever happened the next few days after a vaccine was due to the vaccine, which is sort of like saying breakfast causes lunch. Or they weren't making money on the vaccine. So it's been difficult to keep vaccine manufacturers manufacturing vaccine. They can make more money on other things, other medications. The group that makes those decisions is a group that represents healthcare across the country. What they take from the manufacturers is the research that the manufacturers do to see if the vaccine works. And they look very closely at the research to see if it's appropriate and if it shows what they say it's showing. They don't take money from the manufacturers. It's a very serious and very ethical group. And they want to have a schedule that is the most appropriate and the safest and that has the best effect for health in the country.
So why do you get all of these at once? It would look like to most folks that if you got a whole bunch of shots at once, a whole bunch of vaccines at once, that would increase your risk, and that it might make better sense to sort of space these out over longer periods or give them in some other kind of sequence. A lot of folks want to modify the immunization schedule.
Well, and I have to say it is hard to see your child get a shot in every limb. It's very difficult. It would be better if they could all be put in one syringe and given, I think. The number of antigens or the number of things that cause you to make immunity really in a vaccine is far fewer than what you'd get by putting a little bit of dirt in your mouth. So the number of antigens is, or things that make you produce immunity to that bacteria or virus, is really not an issue as far as safety goes, because like I said, you're getting exposed to that number of antigens all the time walking through the room. But the number of shots is an issue. When they produce vaccines and they combine them, they actually look at whether or not it causes more local swelling in the arm and more fever, and are likely not to recommend a combination vaccine if it causes more side effects than taking them separately. So they're very careful about both of those things. They want there to be fewer shots. We all want there to be fewer shots. So combining the vaccines is a good idea, but they also need to be very careful that combining them doesn't increase the risk of a sore arm and a fever.
Are there data showing that you have to give them in the sequence that is recommended?
Not really. Now there are data when they look at whether or not a vaccine, how often you give it, they're looking at how the research was done. And so the recommendations are based on how the research was done. And they look at whether you produce immunity after 1 shot or 2 shots or 3 shots. So the recommendations are based on how the research was done. I would never put vaccines closer together than they recommend, because that could decrease the likelihood that you become immune. Spreading them farther apart doesn't usually cause a problem, except that you're waiting longer to develop that immunity.
And physicians or other providers really do have health options to spread those out if there's a reasonable reason to do that, right?
Sure, absolutely. Excuse me. Now, if it were my child, I probably wouldn't do that because I want them to be immune as soon as possible. But, you know, if there's no pertussis in your community, then waiting a little while is likely not to cause you to be at risk. Now, if you're taking an infant overseas and it's a place where there's measles, then I'd get them vaccinated before it's even required or before it's recommended.
So, what is the most likely scenario if we do get further exemptions in the state so far as what would happen? What is your prediction?
Well, I don't have a crystal ball. What I worry about, though, is that if we get philosophical exemptions, we'll have fewer kids vaccinated, and we'll be like many other states that have measles outbreaks and have big pertussis outbreaks. It would really worry me. There are states in this country that are really struggling with these things. Ohio has had hundreds of cases of measles, and measles kills kids. And causes bad problems. It's not a benign disease. I know we think, oh, measles, you get a rash, but it's really a pretty serious illness.
Is there any points that you wanted to make that we haven't covered?
We have a really good, strong immunization law in this state. We do so poorly on so many health assessments, bad cardiovascular disease, obesity, even smoking. We're really good at immunizing our kids. I don't want that to be another area where we drop to the bottom of the pile.